Welcome to Ingrid's World. I'm your host, Ingrid Parris-Hicklin. On this show, meet Dr. Chaudhry, a dentist in Northern Virginia. Dr. Chaudhry has for 23 years provided treatment in the field of general and advanced dentistry. Dr. Chaudhry has helped thousands of patients of all ages in state-of-the-art technology focused on patient convenience, comfort, and satisfaction. Then we'll be talking with Medani Adhikari, who has over 25 years of diverse experience that includes validation in software, justification, documentation, laboratory management, and he is also a highly respected professor and owner of Micro Logistics Incorporated. Our last guests are youth reporters Parris-Hicklin and Isis Wallace. They will discuss how they like to communicate. So let's just sit back and put on a beautiful smile as we learn these wonderful programs. Welcome to the show, Dr. Chaudhry. Good
Thank
to
you.
have you.
Yeah. It's a pleasure to be here.
Well, I tell you, so first of all, let's tell our viewers a little bit about yourself.
Yeah, you said my name is Maqsood Chaudhry. I'm a dentist and have been practicing in Northern Virginia for the last 23 years. And I have enjoyed each part of it, and I have a passion for dentistry. And I graduated from West Virginia University in 1992 and did residency. Then I came here in Virginia. That's where I wanted to be, and it's a great place to do business and serve the people.
Wow.
And I like to interact with the people of different backgrounds, and here you find variety of different people of coming from different ethnicity, and I enjoyed each one of them, working with them.
So tell us about your dental practice.
Well, I have one main office is in Fall Church, Virginia. It's Bailey's Crossroad, and another office is in Tyson's Corner. And we have established a network of branches where it becomes convenient for the patient to walk to that particular place and not to drive in these congested roads. Nowadays, the traffic is getting a little bit heavy. And that's what has happened throughout my last 20 years. And as the patients start feeling like driving is far, I try to open convenient place for them.
Exactly.
Yeah.
So now, who is usually using your dental practice?
Basically, we serve to all ages.
All ages.
I have some training dealing with the kids, even with the kids of the special need, and I am associated with the Virginia Department of Health for providing services of special need patient, and
wow.
I got some training, and we serve them as well. So along with that, we have teenager. We provide comprehensive orthodontic treatment. I have other staff in my practice, and we do general dentistry. I have other associates. And we have periodontal treatment and implant dentistry. I have specialists coming to the office.
Wow.
And also endodontics. And so basically, most of the services are provided in our practices. We do refer patients when there is a need for that one.
Exactly.
And,
exactly. And because that's really very, very important. And now, Dr. Chaudhry, you have a variety of services that you provide, and I also see that you brought us some models here.
Yeah, absolutely.
Okay, so you know how I feel about dentistry. Well, although thanks to you, I'm doing a lot better. Thanks to your wonderful work.
I'm glad it's working out.
And so, what do these models tell us about that you've brought for us?
Well, basically, this model will help. It's a visual thing. When you see it, you can understand better. And I brought some model just to make my audience and listener and to understand what we are talking about. And you mentioned how we can prevent the tooth decay.
Yes, exactly.
Yeah, and well, what I will say, the tooth decay, we have to go to the root cause of tooth decay. Is basically decalcification on the tooth structure.
Okay.
And the decalcification can happen because of a variety of reasons. Either you are not brushing properly, or you are eating or drinking food which can produce acidic environment, and when there is acidic environment, that leads to decalcification.
Wow.
And if it's not treated immediately, then it becomes smaller cavity, then it grows bigger.
Wow.
And in one of the model, I can show you here. So basically, when let me see the other model here. So if we can zoom in, this is a just flip it over here.
Well, oh wow.
Yeah. So basically, this is a pulp chamber in the inner part of the tooth, and on top of that one is a dentin layer, and then there is enamel. When the decalcification started, the enamel part, if we address that one at that level, then it's easier to fix that one by doing smaller filling. It does not need much anesthesia and things. But if it's ignored, it go deeper down, and it can get very close to the pulp, and then it become a little bit more problematic. And if it's get involved with the pulp inside and the bacteria goes inside the pulp, then we don't have any other option but to do the root canal treatment. And that's where we have to understand that by going to the dentist on timely manner and getting teeth fixed on timely manner prevents the major problem, which can lead to the
on a timely manner.
On timely manner.
And that's really, because one of the questions that I always like to say is that, okay, how should we be taking care of our teeth, and that's probably.
Well, the first step of taking care of teeth, I will suggest, is the oral dietary habits of an individual. Some people have a habit of drinking a lot of sodas or sweet drinks. That's one part, but another aspect is the frequency, how often they drink it. You may drink one or two glasses of drinks, whatever of your choice, but you may drink in 1 hour. Another person can drink in the period of like 7-8 hours, taking sip every minute. Every time we take a sip, we are actually baking soaking our teeth into that environment. And if it's acidic environment, like in case of sodas or carbonates or lime or citrus drinks, they create more acidic environment, and when there is acidic environment, there is decalcification.
Oh my goodness.
So what I suggest to most of my patients is that even if they are drinking sodas, make sure you immediately go and rinse your mouth really good with the water. That's the minimum thing. Do not brush immediately, because sometimes people drink soda and they go and brush. That is more dangerous in certain situations.
Oh my goodness.
Because it's like you are brushing your teeth with the acid inside, Yeah, so these are simple things. This is one of the things which need to be addressed. So basically what I will say in a nutshell, that if you are drinking sodas and things, the limit is time usage. Maybe instead of, you can drink as many as you want to, but make it like a 1 hour segment or whatever time, half an hour. Then after that, immediately you can go and rinse really good and finish your meal with either with the fruit or vegetables, which are a little bit harder, and so your teeth get cleaned itself.
And it cleans itself. So, we're going to see a wonderful video that you brought for us that really talks about how we should be brushing and taking care of our teeth. But as we start talking about it, what do you see one of the greatest, fears that people have about coming to the dentist? Do you ever?
It's a lot of them, a lot of them. I do some oral sedation dentistry and nitrous sedation as well. So sometimes we put patient under GA. My facility has a general anesthesia room, and but the people, I have noticed that some of the people coming to the office, they are more scared than going to the hospital and getting surgery done than coming to the dental office. Because over there they feel like once you go there, you're knocked out and you don't feel anything. While coming in the dental office, you have continuously listening of those sounds. And it's very interesting to see different people have different reasons to be scared. Some people are scared of the dental sounds which are around them, and that's easy to fix. You can just go ahead and put them give them earplugs and some headphones which have some music of their choice. That can help them.
Wow.
Some people are scared of their needle. They are phobic of needles. So we use in our office for those kind of patients.
Wow.
It's called computerized anesthesia. It's other name name for this one is WAND, W-A-N-D. What it is basically is instead of having regular typical syringe, you use a plastic tubing that could be used to penetrate in the
Well, I can tell you, I visited your wonderful dental office and felt completely at ease.
Yeah.
Well, I just have to thank you for bringing the models. You'll have to come back again to talk about us, and I'm hoping our viewers are out there really taking care of themselves. So what I want everyone to do is to stay right there and watch the wonderful video that Dr. Chaudhry brought for us on brushing and flossing. And remember, if you drink a soda, Dr. Chaudhry said, wash it out. All right, that's your trick for today. All right, coming up next, we'll be talking to a wonderful guest who is also a professor at American Military University. So please stay right there. We'll be right back.
No treatment will be effective unless you follow it up with routine and proper home care. This means you should brush and floss regularly after every meal, and at a minimum twice a day. The key is not only to do it regularly, but also to do it right. Here's how. To properly floss, you should wind the floss around both of your index fingers and push it between each of your teeth in your mouth. Make sure to freely move the floss upwards, downwards, and even sideways to remove any food particles or plaque that may be lodged between your teeth or under the gums. Many people these days use an electric toothbrush, such as a Sonicare. Whether you use an electric or still prefer a manual brush, you should hold the brush at a 45-degree angle to your teeth. Gently but thoroughly rotate the bristles across your teeth and under your gums with a backward and forward motion. Be sure to also get the top surfaces of your teeth where you bite or chew on food. Your tongue can also be cleaned with your toothbrush, which will help reduce bad breath. Lastly, it is important to clean the inside surfaces of your teeth with the same rotating motion. When brushing, it's also important to use toothpaste that contains fluoride. Fluoride helps harden the outer layer of the tooth, called enamel, which will prevent cavities and also reduce bacteria in the mouth. It can also reverse the formation of smaller cavities. Lastly, antibacterial rinses can also help reduce bacteria in the mouth. Please check with your dentist or dental hygienist if you have any additional questions.
Well, welcome to the show. So great to see you.
Thank you, Ingrid. Thank you very much. My pleasure.
Well, let's have you introduce yourself to our viewers.
Thank you. My name is Medani Adhikari. I'm from Nepal, the Mount Everest, land of Himalayas. So I have been living here since 1996. I came as a student and I live in Fairfax, Virginia.
Wonderful. And it's so exciting that you are here. Now, what schools did you attend?
I came for a higher education here. I graduated from Minnesota State, Mankato, with a Master in Applied Economics. Then later I went here.
Wow.
To Eastern University. I have a Master in Communication Technologies, and from Nepal I have a degree in English Literature, so I have almost
multifaceted.
Kind of.
It sounds very
kind
much.
of.
And not too much sleeping.
Not that, it took time also.
Took a lot of time.
Yes.
But you work very hard. Now, you work also as a professor.
Yeah, I'm a
Please tell us
professor at
about
American Military University. It's been 8 years. I'm a tenured professor. I teach micro and macroeconomics. It's all virtual environment. Most of my students are active military, so they spread all over the world.
My goodness.
They are flying there.
That's fascinating.
Oh, and then because it's online thing, is helping everybody, and it's a time of globalization. Your kids, my kids, they have a global competition now because it's turning into a village.
That's right.
And learning is easier, but competition is bigger. So I teach them micro, macroeconomics. Globalization is ultimate capitalism. Big fish is eating small fish everywhere. So we discuss
Small
that.
fish everywhere.
Everywhere.
Sometimes I feel like that.
Yes.
Well, now you also have a company that you've.
Yes.
And I loved what you were telling me about that.
Yeah, I have a company, Micro Logistics Incorporated. So I started in my basement 6 years ago. I was working for, and I found out that, you know, maybe I'm better than others, because I was working with the Ivy League guys, and the student they went to bigger school, but I didn't find they're better than me, and I said, why not I venture out myself? So I started a small company. So when you go to a restaurant, a chain restaurant, what happens? They just prescribe you whatever in the menu, but as an engineer and a professor, I can create my own menu. I can give customized services, so I can add more value. So I started a company, and it's going great, actually. One of the best decisions of my life.
Oh my goodness. So in terms of your success, you know, how were you, tell us about the many successes that you've had.
Oh, success, there is no shortcut for success. That's the number one formula. Because as an immigrant, I'm here, and I'm successful not because of immigrant, not because of Nepali. It's a land of opportunity, one thing. Second factor, it goes a lot of to put together to be a successful man. As a student visa, I have a lot of hurdles. Not like average American like you.
Yeah, like myself.
The expertise and skills never a question. Question is following the path of, you know, legalization and this and that. So yeah, I have a lot of tough times, but as you know, tough time does not last long. Tough guy lasts long.
That,
so I survived.
You know, and that's what is so important. So what has been the key to your success? Because you said about tough times.
It's always be a persistent guy. Never give up, you know. Time gonna come. Your time may not be today, may not be tomorrow, but the day will come. So be persistent, never give up. And if you have a expertise as a subject matter, they're gonna definitely come up.
Dig in it.
Dig in it. And then it happened exactly in my life. And whatever dream I have dreamed, almost 90% achieved already. That means I'm very close to my final destination, you know. As a young boy, raised in a petty farm, I was number 10 out of 12 children.
Number 10.
And I'm living and riding American dream now, because as a professor, as a business owner, and as a volunteer, community activist, and we run the global charity. So you can do things if you are focused, but one thing is key. You don't want to do different things, you want to do differently. You have to be different than others, the rest of the crowd, so people can recognize you. What is your X factor? That you need to be able to display that. So that is one of my key. I always love to meet people, and I have been lucky. I always met the right people, probably.
Now tell us about your foundation.
So it is a Equality Foundation. So I came from Nepal, and there is no electricity, no internet, nothing when I went to school. So I graduated. I opened a foundation 5 years ago. I put my own money, and through the Rotary Club, we modernized the school. So it is a very good public school in Nepal. We want to give internet and computers to the public school, because it is an era of digitalization, but there is a big digital divide. We want to arrest the digital divide and give the means. Okay, cell phone everywhere, but they are for commercial purpose. What is the educational and free purpose? That is a computer and internet. So we started Equality Foundation last year in August with very distinguished individuals. I happen to be the founder. So we want to give internet and computer to poor school children, so that one day guy like me who came to all the way, they have better mind in the rural area. We need to empower them. That is my vision.
Wow, and what a wonderful way. So you talked about your success. I have to ask you this: did you ever face any roadblocks?
Oh, many. I told you. First of all, as an immigrant, you have a legal issue always. This is maintained. Second thing is a financial. We don't have a helping hand here and there. Every day is a survival day. So you cannot afford to have an issue here. Otherwise, there is no helping situation. Number three, not only you stay here, you need to maintain the status. Either you have to be a student or you need to have a working visa. It costs a lot of money. Whereas you are an engineer, you have a degree, you cannot work legally. So a lot of hurdles. It's not my story, it's average immigrant story.
That's why I'm so glad you're here in Ingrid's world, because you know, we see the issues, and to hear someone like you're making our country so wonderful, you know, and that's good to hear the stories.
Yeah, because if you, whatever the degree you have, you know, the best lesson comes from life. So I have seen good, bad, and ugly already. So I don't need a PhD or anything from Harvard. The lesson I learned from life is more expensive and advanced. So what happened is, guy like me, I believe, because I talk to many of us in my circle, that we do not forget our roots. If I change 100 lives in lifetime, I may help to make the world better place. That is the philosophy.
Now that's a really key. So it sounds like what you're saying to me is that you succeed, but you go back and you try to help others. You don't forget your roots.
Never, because they need little help, and little help is the big help for them.
Wow.
So people who look up to you, if you change not, for example, 100, even 10 lives change. I change my village because I help modernize my school. There is a computer class in my rural area now, and people are very much motivated. Hey, we can do, look at this boy. He was one of us. He is a professor. So I'm kind of like living example to my village people. In American, they have everything. Look at the today's kids. There is a lot of disorientation going on about many things, a lot of distraction. Can they be focused? Because it's a digital era. Tomorrow, if they don't focus, there is a digital era coming. Their job will be replaced by the robots. So what they do?
How about that? And that's key. So I have to thank you for being on this show, because you're inspiring to all of our viewers, whether you're from this country or you've come from another country, because what you say was important. All of us should remember our roots, reach back and help someone else.
There is nothing better than giving back to community. Thank you, Ingrid.
Thank you for being on the show. You're wonderful,
Thank you very much.
Coming up next, we will talk with Parris-Hicklin and Isis Wallace. Well, welcome to the show, Parris-Hicklin and Isis Wallace. It was great to have you both back.
You too. Thank you.
You're welcome. So my big question is, how do you like to communicate? And who would like to answer that one first?
Me.
Okay, Isis.
I like to communicate via text or email, but yeah, mostly texting. Because I think it's a faster way to get to the point, and the emails are fast, and they send in 1 second.
Beautiful. And Alyssa, how do you like to communicate?
I'd go with texting too, because writing letters takes like a long time. But then again, I do write to my grandmother too.
Oh, you do? And what do you write?
I just tell her on how much I miss her, and I just check on her.
Nice. And how long have you been writing letters?
For like 2 years.
Wow.
I usually only do it when I have nothing to do.
Ooh. And Isis, how long have you been texting?
Ever since I got my first iPod, and I was able to text my friends and my mom if there's something happening or something. Mostly for emergencies or something.
Right. So now with the electronic, are there some do's and don'ts when you communicate that you should do and, or should not do?
Yes.
Alyssa?
You should never say anything rude to someone online. That is called cyberbullying, and you should never cyberbully.
Okay. Wow. I like that.
And you should never text something that people will take the wrong way, because they don't know if you're mad or something. Some people type stuff in all caps and they might think you're mad.
Oh my goodness. So with texting, because I'm in a different generation, are there some things that maybe I wouldn't know? So if you text in caps, That's mad. And what else do you do in texting?
Emojis.
Yeah.
Emojis. Oh my goodness. What's your favorite emoji?
The kissy one.
The kissy one. And what's your favorite one, Isis?
I would say the queen one.
The queen. That's very cool.
Because it reminds me of Beyonce.
Ooh, I love that. So what would you like to do if you had like I know you have great imaginations. What would you really like to do in terms of communicating? What would you really, let's say, other than, you text, you email? Do you email too?
Yes.
Good. Any other things that you like to do in terms of writing?
It's rare that I send, usually for birthdays I send cards.
Oh, nice.
That's
Sometimes
communicating.
I draw pictures on my letters. It's fun to do that.
Nice, very nice. Well, I bet you both of you probably write very well. You've been writing for the past 2 years, probably more than that.
More than that. Since first grade.
Since first grade.
First kindergarten.
First in kindergarten. And what about you, Alyssa?
Probably since same as her. Yeah.
Wow. So I bet you all are wonderful writers. I bet you I'm looking at some A students. Well, keep up the good work, young lady.
Thank you.
And thank you for being on the show.
Thank you.
My youth reporters. I would like to thank our wonderful guests for being on the show. Our quote this time is from Lorraine Hansberry. Never be afraid to sit a while and think. Thank you for watching Ingrid's World, and don't forget to friend us on Facebook and follow Ingrid's World VA on Twitter and Instagram for instant Ingrid World news. So stay in touch and be a blessing to someone today. This episode of Ingrid's World is underwritten by Dr. Chaudhry, the Dental Center of Tyson's Corner, located at 8270 Greensboro Drive, Suite 101 in McLean, Virginia. They can be reached at 703-578-8888. The Dental Center of Tyson's Corner is a family-oriented practice that uses the latest technology and techniques to maximize patient convenience, comfort, and satisfaction.